introduce you first. Hello, welcome to another segment of My Sister's Keeper Cleveland Sister Circle. I am joined here by two wonderful ladies who wanted to share with us some information about research that they have done or are in the process of doing. Massage ABC study, which is massage after breast cancer surgery. And I will let them introduce themselves and tell you about their research. Take it away, ladies. Thank you.
Hi, my name is Darian Schuler. I am one of the research coordinators on this study, along with Elodie.
Hi, I'm Elodie Nanjurma, and I'm also a coordinator on this study.
And some of the other staff is Dr. Ash Sagel. He's the principal investigator on the study, and our project manager, Jackie Delata. So I'm going to go ahead and get started. So just some background on the study and our previous pilot study. So previous research has found that about 25 to 50% of women who undergo breast cancer surgery will develop limiting mobility and pain after surgery. And this deeply affects quality of life, sleep, body image, had persistent pain and mobility many months after surgery. And we compared two different types of massages. So the myofascial deep tissue compared to a relaxation massage. And we found that the women who received the myofascial massage had marked reductions in pain and mobility compared to the relaxation massage. So just some project overview. So the study was funded by a grant from the National Institute of Health in July 2019 for 5 years. So the main goal of this study is to reduce pain and mobility limitations. And we do so with different mechanisms, including tissue flexibility, pain and sensitivity, and some shoulder range of motion questionnaires. There were 6 months of training and development for this, so we work very closely with the gathering place. This is where the massages are held, 2 different sites, and we developed myofascial and light touch massage protocols. And then we hired and onboarded and trained 8 massage therapists for the study, so they were all trained the same way and used the same protocol for the myofascial and the light touch protocols. And we first launched the study in January 2020 when we first started recruiting patients.
So some important criteria that you need to know are that in terms of recruitment, so we are looking at women that have had surgery within the past 3 or 24 months, meaning that if you have had any type of mastectomy, lumpectomy, or had some lymph node removed in the past 24 or 24 months, you could be eligible for the study. Or if you have had it also in the past 3 months, you could also be included in this study. So if you are currently receiving some chemo or radiation, you could also potentially be included in the study. However, we would like you to be done with your chemo and also your radiation before beginning the study. So also one thing that you need to know as well is in order to be part of the study, we ask that everyone be done with all kinds of treatment, including PT. So we only want women to only be receiving our treatment. So in terms of exclusion criteria, we do not include women that have bilateral cancer. And by that, we mean women who have received remove both breasts, both of the breasts. If you have removed one of your breasts prophylactically, you could still be included in the study. However, if you have cancer on both breasts, that disqualify you. Lymphedema is also a exclusion criteria, and if you're also taking blood thinners, that unfortunately disqualify you as well. So this study is to help women that are currently experiencing some mobility issues. So you need to have some mobility issues to be part. So hence us asking some mobility questionnaire as part of the study. So please move to the next slide, Clarion. So the goal of the study is to recruit 202 patients into the study. And as Darren already mentioned, so there are two types of treatment that will be going that we are actually studying, which is myofascial massage and light touch. And everyone into the study are being randomized. So a computer is actually doing that part. So Darren and I are blinded. We have no way of knowing which one of the two the patient will be receiving. So depending on the treatment that the patient will be receiving, they will either be receiving a 30-minute treatment or a 60-minute treatment. And this variance is depending on if they have a bilateral mastectomy. So if you have a bilateral mastectomy and you have pain on both sides, so that explains the 60 minutes. And also, like Darren mentioned, our partner in this study is the gathering place. So depending on availability, you may receive your treatment at the Beechwood site or the Westlake sites. We sometimes try to see if work with the patient choice to see if we could get them which works with their calendar and availabilities to see if Beechwood works better or Westlake West better. So we try to work with the patient as much as we can. So the treatment itself takes 8 weeks, but there is a 12-month follow-up. So after your 8 weeks treatment, so you will have a 1-year follow-up to come to. So the whole study takes about a year, but after your 8 weeks, you won't be seeing us until a year after. So that pretty much concludes what the study entails. So do you have any questions for us?
No, it was very well explained. So, is there anything you can do in the interim, like before you are, chosen for, or if you are chosen for this? Because I am dealing with a lot of those issues. My surgery was August 17th, and I had a double mastectomy, and then one was prophylactic.
Mm-hmm.
So I am having a hard time sleeping, and I am having a hard time, is there anything that you guys advise just while you're waiting, or?
Not per se. I mean, like, at least what I would say, like, for our end, so usually what we do is, like, you will go through a questionnaire to see if you qualify for our study. And once you qualify, obviously, we will go through enrollment and everything, and then you will start the massages. But I think what you are asking us is there some tips that you could do on your own to help you sleep better? I mean, like, I'm not a oncologist or I'm not a therapist, so it would be hard for me to give you a recommendation on top of my head right now.
Yeah, okay, I understand.
I mean, we know some people do try, Pilates, yoga, different types of movement, just kind of exercising, getting those muscles moving again and stretched out.
Okay, that's good advice. Okay, alrighty. No questions.
Yeah, so please keep us in mind, take our contact information, so when you're ready to be screened, please reach out to us.
Okay.
Yes, I was going to ask you if you can state your contact information as well for people who will view the recording. And then in addition to that, is there any like assistance as far as for people who may need transportation to get to either location, or anything like that?
One thing that we have not mentioned is, like, there is an incentive to participate in the study. So Once you are enrolled in the study, you will be compensated a total of 160 in total. So there's a set of assessment that you'll be doing throughout the whole study. So like baseline assessment, end of study assessment, and your year follow-up that we mentioned earlier. And you will also be having like some phone calls, like survey questions. So for the actual assessment, the ones that you're coming for the in-person visits, you'll be rewarded for $40 as a token of our appreciation. And for the phone calls, you'll be receiving $20 to answer some questions. However, you just ask if there's transportation. As of yet, we have not had, we do not have transportation, but we are working on it. But so far, we do not have we haven't been able to provide transportation for the patients.
Okay. And the questionnaire that you spoke about, how do we this? You just email it to me, or how does that work?
No, it's a phone questionnaire. So basically, like the phone, those are on phone numbers. So if you're
Yep.
interested in the study, you just give me a
Give
call,
you
a
that.
Darian a call, and you just you express your interest in the study. And I
Okay.
would just go through the questionnaire. It's a quick questionnaire. It will probably take about 10 minutes or 15 minutes or so. We just ask you parametric questions to see where you have received your surgery, what type of surgery you have gotten, and for us to get to know you, to understand your pain and immobility issues, and see if you have passed the pain scale. And then if you pass, we just tell you that yes, based on the pain scale, you actually you have a pain threshold, and then we'll tell you that you qualify for the study, and then we'll schedule you for your assessments. That's how it goes.
Okay. All right. That's easy enough.
Thank you so much. Thank you for your questions as well, Amy, and you too for joining us. So I see that you posted the slide to have your information there as far as the phone numbers. And then I will read the email that you guys can send a message to. The email is D as in door, S as in Sam, C as in cat, H as in hat, U as in umbrella, E as in elephant, L as in Larry, another L as in Larry, E as in elephant, R as in Ralph at metrohealth.org. So you can definitely also reach Ms. Schuler via email as well, in addition to the telephone numbers. And then I just have another quick, brief question. I had made you co-host, and when you were going over the background slide, I think the internet kind of like phased out and we missed part of that. So if you don't mind just reviewing that slide again, the background,
Oh,
so
yeah.
we can make sure the viewers got all of that information.
And did you get all my information when I was speaking, or do you want me to go through this? Okay. Yeah, so please reach out to us if you have any other questions, and then feel free to keep our flyer posted to your website. And if anyone has any questions, please refer them to us.
All right. I appreciate you ladies even offering these services. Yeah.
And we still have a ways to go to for recruitment. So we are recruiting 202. So if you're not in the window right now, it doesn't mean that you'll be excluded anytime in the near future.
Okay.
Awesome. And I also have Elodie. I'm sorry if I pronounced it wrong.
It's all good. It's like Melody without the M, so it's Elodie.
Oh, okay. Awesome. Elodie. So I also have Elodie's email as well, and I will read it to you all. It's E as in elephant, N as in Nancy, O as in Oliver, N as in Nancy, G as in goat, U as in umbrella, I as in ice cream, E as in elephant, R as in Ralph, M as in ma'am, A as in apple at metrohealth.org. So you can reach either of those ladies, and you saw the slide with their phone numbers as well. And again, I can't thank you enough for joining us. both of you as well as Amy, and for her wonderful questions. And I hope that you guys get some more people to join your study.
Thank you.
And I'll reach out to people that I know as well and see if they're interested.
Oh, yes, please do.
Or spoken to see.
Word
if
of
they-
mouth. Word of mouth is really important. So
Yeah.
That's awesome. Thank you. Thank you.
Thank you so much for having us.
thank you.
Thank you. Thank you.
Bye.
Thank
Bye.
you, ladies. Take care. Bye-bye.
Bye-bye.